usually takes place in the local ground regulation system, which is a communication system, which makes up about the 40% of the body's tissue. Not only that, but it is 87% of the submucosal area, like in GI tract and also the respiratory tract and in the dermis. As you see here, there are 3 types of cells, which is the mast cells, and mast cell has become very important as far as the chronic inflammation is concerned. And the fibroblast is equally important in chronic disease because when the fibroblast is not under control, it spits out a lot of proteoglycan. This is the amorphous substance which is in the extracellular matrix. And when there is a large amount of it, in the presence of a low amount of water, in a dehydrated state, it it prevents the normal communication, and thus the dyshomeostasis also takes place. And then our biggest friend and foe is a macrophage. And the macrophage can be inflammatory, pro-inflammatory, or it can be anti-inflammatory. So there are called macrophage 1, which is the inflammatory macrophage. Pro-inflammatory releases the pro-inflammatory cytokines when it does the function of phagocytosis for bacteria and the fungi and the other organisms. And the pro-inflammatory cytokines are the ones that goes and polarizes the naive T cells and giving the problem with the inflammation. And then there is a anti-inflammatory macrophage, which are called M2 macrophage. And so there is a balance there too. We are talking about chronic fatigue. So I want to also point out that these mast cells are within the 0.2 micron distance from the sensory nerve fibers as well as from the vascular system. And there is a reciprocal relationship between the capillaries and the regional and central connections with the immune system, neurological system. And whenever there's a dyshomeostasis, there's a neuroimmune endocrine system is the first system, 3 systems to respond. So we call them neuroimmune endocrine triangle. And if you see here, these are the terminal axons of the autonomic nervous system. So in many times when the system in a chronic fatigue patients, there is an autonomic nervous system dysregulation. So it is important that you understand when one is talking about the chronic diseases, mentally you have to remember this picture and say, where does the dyshomeostasis is taking place and how does it affect the neuroimmune endocrine system? Now let's look at the mitochondria. Mitochondria in the young ones, there are like 8 ATP and 2 reactive oxygen species. It is not only in the young, but in the healthy individual, there are more ATP production in the mitochondria, and there's a less number of reactive oxygen species. Whereas when one is older, aged, sick, has a chronic infection like mycoplasma pneumoniae, chronic borreliosis, there's a less production of ATP and a higher production of reactive oxygen species. And as a result, we see the problems in the brain as a cognitive dysfunction and in the body as a chronic fatigue. Now, again, this one shows that the oxidative phosphorylation is very essential for ATP formation. And oxidative phosphorylation occurs in the matrix of the mitochondria. And so it does not occur in the inner membrane, outer membrane, but in the matrix of mitochondria. And mitochondria generates ATP by using the oxygen as a final electron acceptor, which I'll just show you in this next slide. Sorry. Here. So here, as you see that this is the electron transport chain, and it starts with NADH, which goes into the NAD, and then that has also ubiquinone or coenzyme Q10. Then you have a cytochrome 3 and cytochrome oxidase and ATP synthase. And after all this molecule continues to move in the sequence, right in the matrix, and then once the ATP is produced, it is accepted by the oxygen, and then the energy is there in the system. Another thing, what is important, that the ATP generation occurs by the oxidation of food. 4% of the oxygen which we breathe is used for the mitochondria for oxidation and formation of ATP. However, there's a higher rate of production of the reactive oxygen species. What is mitochondria important for? The heat production in the body. So when somebody is cold all the time, yes, you look for thyroid because it is important to look, but it indicates that an individual's mitochondria have a problem with the good functioning and production of heat. Then it also is important for the regulation of the membrane potential by regulating the calcium homeostasis, because proper concentration of calcium ions within the various compartments of the cell and the calcium stores is important. It is also important for the formation of steroids, including the estrogen and testosterone and similar other enzymes of hormones. It is also important for the detoxification and apoptosis, programmed cell death, because if mitochondria is not working properly, you may see one does not destroy the sick cell, and programmed cell doesn't occur, and one may have a abnormal tumor growth. And of course, we all know by now that caloric restriction helps the mitochondrial efficiency. And photobiomodulation also is very important for rejuvenation of mitochondria, as mitochondria are the principal photoreceptor cells, and they are activated by the light, and it increases the ATP production. So any kind of chronic stress is modulated by the photobiomodulation, and it normalizes the dysfunctional state, and then it upgrades the normal function by having the direct effect on cytochrome 3 oxidase system of the electrotransfer chain. Now let's look at the effect of the Certifiance NAD on mitochondria. Harvard studies describe that there's a close association between Certifiance genes, mitochondria, and NAD. Cert1 gene induces the formation of new mitochondria only in the presence of NAD. So if you have a normal mitochondria, if you have a normal Cert1 gene, but if you do not have NAD, you will not have a formation of new mitochondria. NAD controls the health, numbers, and function of mitochondria. And it is very important. So you need the NAD for formation of new mitochondria, keep them healthy, and function then normally. So when there is a reduced level of NAD, it reduces the activity of certain genes, and it also reduces the communication between the cell nucleus and the mitochondria. And there is also plays a role in dysfunction and induces the dysfunction in hypothalamus, which results in dysfunction of the endocrine and the nervous system. And as we know that hypothalamus is very important to maintain the body temperature, thirst, appetite, weight control, emotions, sleep cycles, and many other functions. Another important fact is that central nervous system is more susceptible to reactive oxygen-induced damage because the mitochondria and brain have little resilience to illness or trauma, and it triggers the sudden, massive, irreversible damage. And another thing that the CNS have a high consumption of oxygen. It consumes the 20% of the body's oxygen consumption. And we know mitochondria has a 4% of the body's oxygen consumption. So they are very high oxygen consumption organs. Now, what happens is when there's a high amount of oxygen consumption, there is a high amount or the increase in the production of reactive oxygen species. And CNS is relatively deficient in oxidative defense because it has a poor catalyzed activity and has only moderate activity of superoxide dismutase and glutathione peroxidase. So it's important, and CNS has a higher content of iron and ascorbate. Thus, there is also enhanced Fenton-Haber-Weiss reaction, which generates the more reactive oxygen species. So in a chronic Lyme patients or chronic infection patients, first develop the cognitive dysfunction and then their loss of cognitive function because there's ongoing damage. And if it is not controlled, then the degenerative disease and the dementia develops. So during the progression of the chronic fatigue, mitochondria goes through the profound alteration, reduced generation of ATP, enhanced production of reactive oxygen species, loss of calcium buffering capacity, and initiate the cascade of deleterious events within the cell, and apoptosis occurs. Damaged mitochondria also release several proapoptotic proteins that translocate into nucleus to induce DNA fragmentation and cell death. Now you understand that mitochondria does not produce its own glutathione. Glutathione is transported into the mitochondria. Thus, the mitochondria glutathione level of the body and the cell and the cytoplasm is related to the content of mitochondria. And so there's constant need of glutathione for the health of mitochondria. So as I said that mitochondria does not synthesize glutathione, it is transported from the cytoplasm to mitochondria, and mitochondria glutathione plays a critical role in protection of the cell. Another important fact is vitamin D acts as a catalyst for glutathione production. So besides working on the immune system, it works indirectly through the production of glutathione as one of the factors. And it's important to remember that glutathione is a primary determinant for cellular redox environment. It's not only antioxidant, but it is antitoxin. So when our patient have a problem with the biotoxin, Lyme toxin, mold toxin, mycotoxin, when you are trying to kill the organism, it will release a lot of toxins. And at that time, they start having the Herx reaction or Herxheimer reaction. And at that time, glutathione infusion can work as antitoxin. It will help to augment the detoxification of the toxins, xenobiotic and biotoxin, and helps the patient feel better. It is a free radical scavenger, and it is related to the DNA synthesis and repair, protein synthesis, prostaglandin synthesis, amino acid synthesis. And when there is overproduction of reactive oxygen species in a reduced level of glutathione, it results in a mitochondrial dysfunction and diseases. So now let's look at our case presentation that last time I promised you that we will go through. Okay, so this is a young patient. She was in 2017, she was just 15 years old. And she suddenly experienced flu-like symptoms. And over next 6 months, symptoms progressed. She developed chronic fatigue, constant dizziness, nausea, heartburn, visual disturbances, and was unable to attend school full time. So in following few months, she continued to remain sick. So she went to Cleveland Clinic, and then she went to the Mayo Clinic in Jacksonville, Florida in October of 2017. And following first consult, and she came to our center. In November of 2017, her preliminary diagnosis made at our center based on detailed history, clinical evaluation, as well as detailed comprehensive blood work. Patient was started on treatment and began improving within 1 week. On December of 2018, patient now was 17 years old, and she stated that she feels better now than ever she did before this illness. And in September of 2021, patient said she has continued to remain 100% better, receiving treatment for inhalant, food, and chemical sensitivity. So the number of local doctor visits, she saw 2 pediatricians, 10 neurologists, 1 pediatric cardiologist, 1 naturopathic practitioner, 1 physical therapist, 1 ophthalmologist, 1 developmental specialist, 1 optometrist, and total number of physicians seen were 17. And the lab test she had from February of 2017 to June 2017 were many blood tests, MRI brain, MRI cervical spine, ENT, vestibular testing, EKG. And then she was recommended to have the Ireland syndrome testing because it is a problem with the brain's ability to process the visual information. So she had many tests without proper diagnosis, and she continued to remain sick. The number of treatments from February 2017 to June 2017 she received 14 microneurofluid sessions, 13 vestibular therapy sessions, 9 chiropractic sessions, and 13 deep tissue massages. Total number of treatments she received were 49. None of the preceding visits, tests, or treatments resulted in neither accurate diagnosis nor reduction in her symptoms. So overview of Cleveland Clinic visit in June through September of 2017 prior to visit to my office. Consult included infectious disease, gastroenterologist, cardiologist, who did also the test for parts, neurology consult, and testing at 3 separate trips. Diagnosis of postural orthostatic tachycardia syndrome was made. Hematology consult, ophthalmology consult, and test results. Multiple visits were made. Parts diagnosis did not lead to any treatment that provided improvement. She was just told you have that and you have to drink more water. She was referred back to the local pediatrician after visual disturbances were found unrelated to parts. visual disturbances were not verified by ophthalmologists, and it was presumed that she had Allen syndrome, where she was not able to process the information in her brain. So then in Mayo Clinic visit 2017, she had a neurology consult. She had MRI brain, cervical spine, pulmonary function testing, neuroophthalmologic evaluation. And last visit at Mayo determined further testing was needed. Patient did not return to Mayo second time as I began her treatment in November of 2017. And she was better. Total out-of-pocket cost for inaccurate diagnosis and treatment was $35,852, of which the maximum cost was at Mayo Clinic, which was $18,856, and cost for Cleveland Clinic, attending there for 3 months, it was $9,639. So you can see how our health system, public health system, is overburdened by wrong diagnosis and wrong treatments. Okay, so she came to us in October. Mother requested that they had a very long wait to go to Mayo Clinic. Now they have the Mayo Clinic appointment coming, and would I allow them to go? And I agreed, and I said, more the merrier, go find out. I know what's going to be the outcome. And she smiled at me, smirked, and then when she returned, says, Dr. Patel, you were absolutely right. And then after going through having her comprehensive evaluation, we came to the diagnosis of chronic fatigue POTS, chronic persistent mycoplasma. Let me see. I think our slides are a little bit. Okay, so then when she came, this patient was very sick on arrival, as she was unable to sit for a longer period of time. She was tired all day long. She did go to sleep, but not have a restful sleep. Her past history was completely unremarkable, except she started getting fatigue, which progressively got worse, and she had seasonal allergic rhinitis. Her past treatment were not helpful. She stopped her menses for more than a year. So remember that she had a chronic fatigue, and then she developed and she had already the problem with her immune system with the seasonal allergic rhinitis, and then she had an endocrine problem with her loss of her menses. So as I said, that in state of dyshomeostasis, you have to watch out which system gets affected. Here, she had a neuroimmune endocrine system involvement already, if you look at the triangle. She was unremarkable, except she had tachycardia and change of her posture. Her lab results showed CBC and CMP were completely normal. Lymphocyte flow cytometry was abnormal. She had a relative lymphocytosis, and CD4 count was low. CD8 count was also low. And she had a CD4 CD8 ratio, which was abnormal, as it was higher than 3.2. We like to see them around 2. Ratio should be, the CD4 should be twice the amount of CD8. She had IgG1 and IgG deficiency, and she had CH50, which was greater than 60. So there was degree of immune dysfunction. She had a positive mycoplasma titer, 1 to 2,560 IgM, and positive IgG titers, they were elevated too. She had a positive HRV, which is the heart rate variability test, which measures the autonomic nervous system, and she had a high sympathetic activity and multiple ectopic beats as well as parts. She had with the position change, her heart rate increased greater than 20 beats, difference between lying down and upright posture. Now, this heart rate variability test, when done in our offices, is like $100 compared to when they go and they do it in a big center, it's in thousands. So you see the difference of the charges that patient incurs in the big centers. And this patient, they had the insurance, but it was a high deductible, so most of the cost was out-of-pocket cost. So our diagnoses were chronic fatigue, PARTS, chronic persistent mycoplasma pneumonia infection, dizziness, immune dysfunction, and immune deficiency. Of course, the hormonal dysfunction and seasonal allergic rhinitis, those were present prior to the illness. So what did we treat her with? So once the treating physician has made either clinical or lab confirmed diagnosis of either mycoplasma infection or chronic Lyme borreliosis with co-infection or any other infection, one may start to treat the patient with antibiotics to reduce the total load of organisms like any specific infection. And as I showed you the last time, that barrel analogy, where if this barrel has only certain amount of capacity, and everything we are exposed to in air, food, and water, including the electromagnetic field and emotional stress, inside field, the inside the body and outside the body exposures, they all fill up the barrel. And when the barrel overflows, one is full with multiple symptoms. And so, because the loss of adaptation occurs. Now, so as a result, when there is any chronic infection, it has a capacity to fill the larger part of the barrel and overflow, and as a result, many symptoms manifest. So the first important thing in the treatment is reduce the total body toxic load. And this toxic load is derived from the load of organisms of this particular infection, which was the mycoplasma infection. So we have to treat the patient with few agents as they are having a synergistic response. Large number of patients, up to 40%, do not respond to short-term antibiotic treatment. And when patient does not receive long-term antibiotic treatment, one suffers from debilitating symptoms, remains in a constant pain, and is unable to live a normal life, and few will eventually die from the Lyme disease or whatever chronic infections they have incurred. So there are 4 components for the treatment. Treat the dyshomeostatic, dysregulated molecular biochemical physiology. So you may use the naturopathic way, orthomolecular, functional, and environmental medicine approach, hormonal support when necessary. Detoxification is an important part of the treatment, as you have to reduce the total body burden of toxins. So toxins, we usually don't consider when we are dealing or chronically ill patients, those who have chronic infection. But we must remember that toxic metal and aluminum, they work as a growth factor for spirochetes when you're dealing with the chronic Lyme disease. And so the use of DMPS, DMSA, Desferal, ionic foot bath are indicated whenever they are necessary once you establish the patient has the increase in body burden from the toxic metals. The avoidance of Wi-Fi and EMF exposure is also essential because it is a growth factor for the chronic Lyme infection. Now, it is not only chronic Lyme, but any type of infection when it is chronic and when there is a dyshomeostasis. And as I showed you in first few slides, what the dyshomeostasis does. And so there's a EMF is causing the trigger and stimulate either the neuroimmune endocrine system, mast cell activation, and mast cell can have an increase in histamine release and many symptoms related to the high histamine, or it may cause the vascular dysfunction, or it may cause the neurovascular dysfunction. One may develop the symptoms like in the Parts disease, and have also the sex hormone dysregulation like absence of menses. The immunomodulation is also essential in a patient, those who's suffering from chronic infection, because there is also immune dysregulation, and reduce the allergic host response by investigating the patient for the allergy and then provide the treatment when necessary. The avoidance of known triggers like dust, dust mites, and pollens, detect mold and food sensitivities and treat by PN technique or LDA or LDI, and antimicrobials. So when you start patient on antimicrobials, you may make that patient sick. So it is very important that first you look at their GI tract and give them probiotics before you start on antimicrobials. Support their detoxification by drainage formulas, and you can also use the massage. You can also use the deep heat depuration technique like infrared sauna, and hydration. Hydration is the name of the game. If you do not give patient adequate amount of water, and this water has to be the glass bottle spring water, you cannot give filtered water. It's the essential, because the abnormality and dehydration of the matrix will not let the regular communication system work in its own sequence. And so when the extracellular matrix becomes like gel, it prevents the proper communication. So by giving the large amount of water, even you may have to do the water fasting, so that patient takes the adequate amount of water and extracellular matrix changes from gel to the sol, and then the matrix connection and communication continues. So now, as we look here, this is the diagram, which shows that reduce the total load of microorganisms, biotoxins, and biofilm. How do we do it? Okay, so we first have to start using the treat the infection and co-infection. So if patient has a mycoplasma infection, we use the mycoplasma the antibiotics for mycoplasma. So what kind of antibiotics do we use? You use, if it has a cell wall, then you use the cell wall antibiotics, either the orally or IV, depending upon the patient's symptoms. Like my patient, I had patient, she received the oral antibiotics initially, and when it was not very effective, she went on the PICC line and antibiotics through PICC line. So cell-wall antibiotics, which are very effective, can vary from penicillin, cephalosporin, doxycycline, minocycline, or vancomycin. Most of the time you start orally, except in certain cases where the GI tract is a big problem, and then you go intravenous when the infection is in the bones, when infection is in the brain. Usually we start with the IV antibiotics. Now, cystic forms are very common in patients with mycoplasma infection and patients with chronic Lyme. And they become the persistent organism, and they have a persistent antigenic stimulation to increase the antibody production. Now, in this patient, she was sick before she came to me, she was sick for almost a year. And she had continued to have a high IgM antibody. Usually, if you understand, they have a high amount of IgM antibody in early onset, like for first 2 to 4 weeks, and then after 3 weeks, IgG takes it over, and gradually IgM antibody comes down. But in this patient, IgG antibody did not take place as much, and IgM remained persistent. And mycoplasma and chronic Lyme disease are known infections to do this. So it is important that we pay attention to these and then how to overcome these problems. And so cystic form of the antibiotics can be used. The orally, you can give the Plaquenil, you can give Flagyl, Tindamax, and we have used the daptomycin for the intravenous use. Sometimes these organisms are intracellular organisms. And so we have to use the antibiotics to reach them, where you can use the azithromycin, Biaxin, clindamycin, and quinolones. But we do not use much quinolones in our practice, because in chronic Lyme, the organism has a tendency to affect the connective tissue and the elastic fibers, and they give the pseudo-Ehlers-Danlos syndrome type of symptoms, where the quinolones have the side effect also, which involves the tendon rupture and things like that. So we do not want to add the burden to the existing pathologic abnormalities. And then there are certain herbal detoxification products, drainage formulas can be given. And there are some homeopathic formulas that can be used. So in a very, very sick cases, like my case, who was not able to get out of bed, missed the school, very, very sick, IV antibiotics can be given, but only IV antibiotic is only one prong of the treatment. The other prong of the treatment is to provide them the intravenous hydration and intravenous high-dose vitamin C, nutrients. High-dose vitamin C will act as oxidant therapy and killing also the load for the viruses, bacteria, as well as the it provides the antioxidant support when it is given in a lower amount, like about 15 grams per IV. And then intravenous glutathione can be used, intravenous NAD can be used to revive the mitochondria. And if patient has a severe muscle weakness and cannot rebound, we know that the HPA axis is altered, and we have to check their cortisol and And then if necessary, you can check their growth hormone. And if it is low, you can give the peptides. And then peptides can be used for the muscle weakness, as well as there are other peptides that can be used for the anxiety and depression and cognition. The nutrition also needs to be given attention, as genetic and epigenetic changes are there with the chronic infection and DNA damage. To give them the nutritional support. And methylation is very important for nutrient. Give the B6, B12, and methylfolate, and it has the effect on serotonin pathway, on tryptophan metabolism, also on melatonin. So it has a multiple effect on different pathways. And then do not forget to check the patient for candida infection, candida overload, or candida sensitivity. You may use anything varying from the herbal tinctures to nystatin to diflucan. Nystatin does work in the GI tract, does not have a systemic effect. When you are expecting the higher load in the systemic circulation or in other organs, you may have to use the diflucan, but be very careful of using diflucan with the Zithromax, because you can have the side effects, and there can be a problem with the heart rhythm. Reduce the emotional stress, because in the young patients as well as the old, when there is a chronic illness, there's a tremendous degree of emotional stress, anxiety, and depression. And no matter what you do, you have to pay attention to these. And usually we keep the scoring system in our office. We use the Beck's inventory score for anxiety and depression. So at least we know at the beginning what type, how bad is bad, so that we can give appropriate type of medication or whatever is required. Also, we want to stress the sleep and wake cycle is normal. 99% of the patient do not have a good sleep wake cycle, and poor sleep results into the feeling of fatigue for all day. Then there are autoimmunity or autoimmune activation occurs with chronic infection, and that is because of the presence of the chronic antigenic stimulation. And autoimmune system, usually you will find positive rheumatoid factor, positive ANA titer, and some other antibodies, but it's not usually an autoimmune disease. It is the persistent chronic infection resulting into the autoimmune activation. So in summary, you reduce the electromagnetic stress, and then I think that requires another full lecture for that, but at least you know that they cannot sleep with their electronic watch on. Try to tell them not to wear their Apple Watch or other watches similar to that. Also, not have their Bluetooth apply. They have other electro that computers, laptops, they all should be off completely during at night and daytime. They should not be working on that all day long. So in summary, you reduce the total load from the air, food, and water, put them on a gluten-free, casein-free, low sugar, organic food, having lower amount of pesticides and toxins, environmental control for the air, for the mold and pesticide removal, make sure there are no food additives in the food. And handouts are the best way to teach your patient, because cognitively they are impaired, and you cannot give them all the information because they are going to forget. So give them the handouts. And as I told, that they should receive the spring glass bottle water and reduction in the EMF. Now, so electromagnetic removal of that load is by they remove the Wi-Fi, and many times we treat the patients for the metal antigen treatment and LDI for copper, nickel, and titanium and other related metals. Now, when you are treating the chronic infection, you have to make sure that you are treating the patient for biofilm. Use of enzymes. Also, the grapefruit seed extract is very helpful, olive leaf extract, grapeseed extract, oregano oil, and many other treatments. You can use the siraplizyme, and then there are other enzymes. But the important thing is that when you are using the systemic enzyme treatment, you have to give them away from food, at least 2 hours away from food. Another important replacement treatment is vitamin D. We have found that greater than 70% of our patients are deficient in vitamin D. Again, you supply them with the NAD in the form of NADH, and now there are certain preparation of NAD plus are available, but I have not found that effective. When we want to treat the patient with NAD and patient being very sick, we give them the IV NAD. We don't give, we can put the NAD right into their nutritional IV. But NAD is a double-edged sword. So you got to make sure that you don't make patients sick, because they can have nausea and they feel vomiting, or they can develop headache. So you have to observe that patient. Do not start NAD an IV number 1 or 2. Gradually introduce into their treatment. Coenzyme Q10 can be given orally. Their active form can be given orally. Resveratrol, NAC, other immune formulas can be used. As we say that for sleep, you can use the magnesium in large amount, herbal formulas, theanine, melatonin, and you can also use the LDN treatment, low-dose Naltrexone treatment to augment the immune function. Pulsed electromagnetic mat can be used, and it helps to their cell membrane revival. Treatment for mycotoxin, infrared sauna, oxygen, nutrition for the immune support, chemicals and toxic heavy metal treatment. So they reduce the total pollutant load from air, food, and water, including the electromagnetic field, treat for the inhalant and food and chemical entities by the antigen injection. So treat with antibiotics, but support the GI tract microbiome. There is a 1 trillion gut bacteria influences the expression of 23,000 genes. There's a great dance between gut bacteria and our own DNA. So we have to be very careful that bacteria in the gut is not killed completely, meaning the good bacteria in the gut. Because changing the gut bacteria changes the expression of the genome moment to moment. The relation of the gut-brain axis is not only physical, but also it is chemical. Serotonin and dopamine and other neurotransmitters are made in the brain locally. However, lion's share of these messengers are also made in the gut. Thus, if one has a depression, do not only treat the brain, but gut needs a more attention through the gut-brain axis. You can modulate the brain function. So the environmental medicine approach, which is the reduction in total toxic environmental and body pollutant load, is essential. So how do you do the environmental control? Avoidance of triggers for dust mites, mold, pollens is essential, and there are many different ways you can do that by changing their pillow covers, mattress covers, and then using the spatial air purifiers, which removes not just the dust mites, pollens, but also the chemicals and the mold. Which they have also the charcoal filter, and they are able to remove the chemicals, and they have a UVB light that can also destroy the fungi and molecules which are biologic. In our EHC Buffalo study, we reported 50% of chronically ill patients reacted to these triggers, meaning dust mites, mold, and pollens, which contributed to their oxidative stress. Avoidance of clinic chemicals, hair shampoo, conditioners, hairsprays, hair gel, air fresheners, fragrances, and pesticides should be considered and emphasized, and regularly check with the patient, as it's an old habit, does not die that quickly. And so you have to emphasize few changes at each visit. Rotation diet, we use the 4-day rotation diet to reduce the degree of food sensitivity and reactions from the sensitive foods. And we encourage them to use the chemically less contaminated organic food, having low sugar and free of food additives and coloring. And so the total toxic load is reduced. Also support the GI system with use of probiotics. You have to correct the dysbiosis, correct the leaky gut, which is not easy. It occurs over the period of time. It takes between 3 to 4 months to really do the good job, and give them the digestive enzymes, as the pancreatic enzymes and the gastric acid is usually reduced in most of the patients who are chronically ill. So we use the antigen injection treatment based on the intradermal provocation neutralization test for the neurotransmitters. And neurotransmitters we use are usually the histamine. Histamine is not just used as a positive control, but we also find the maximum tolerated dose, which usually try to neutralize many symptoms which are generated through the phase of provocation. Similarly, we find the neutralizing dose for inhalants to which the patient is sensitive, like dust mites, mold, pollens, including the food. We use the same technique. And significant positive impact it has in relief of many symptoms. When PN technique is not used, the low dose antigen therapy can be used for inhalants, food, and chemicals, and which is easier method. Sometimes very sick patients are unable to tolerate, but are able to tolerate later on after 6 to 12 months. We use the low dose immunotherapy for Lyme bacteria, Bartonella, Babepsia, Mycoplasma, Candida, and any infection which we think is the problem. Like when we are dealing with the Crohn's disease, we have a Crohn's vaccine, we have a Hashimoto's vaccine. And we have also for the ulcerative colitis. It's just that you have to again branch out in a different and learn something more regarding these therapies. Nutritional supplement is also very important, and we supplement based on their blood and test, red blood cell test and serum test. And sometime for magnesium, we do the magnesium challenge test and measuring the urine levels pre and post when we think that the patient is magnesium deficient. However, the results for the serum and red blood cells are normal. Urine organic acid levels also are used to diagnose the functional deficiency of vitamins and minerals. So vitamins, what we have found, vitamin A in a low normal quadrant. And we know that vitamin A is very important when we are dealing with the chronic infection. The study was done when there was a measles outbreak in Africa. It was reported in Pediatric Journal, and when they added two groups in crossover study. So the group which was given the vitamin A drops did not develop any complications of measles, whereas the one group which was not given vitamin A drops developed many complications. And then they did the then they again crossed over study. So the patients, those who had complications resulting from measles, were given the vitamin A drops, and the duration of their complication was reduced. Similarly, vitamin B6, B12, B complex, methylfolate, biotin, and coenzyme Q10 are very essential for different metabolism. Minerals like magnesium, zinc, manganese, molybdenum, calcium, and selenium are important. Amino acids, glutathione, NAC, taurine, glycine, glutamate are important. Essential fatty acids, omega-3, monosaturated acids, liver support, and kidney support, kidney drain are all important. And intradermal allergy testing for mold and mycotoxin can be done. Food chemical can be done. Low dose antigen treatment for inhalants, food, and chemicals can be given to help to relieve the symptoms. LDI treatment, as I said, that can be given and used. And to reduce the elemental toxicity, one can use the chelation and nutrients. Always pay great importance to the copper zinc ratio, and you would want the copper zinc ratio to be below 1.2. And if it is high, then give patient zinc as metallothionein and promoter. Zinc, molybdenum, and NAC are very important, including the digestive dipeptidase. So it is important that you remove and reduce biotoxin and their toxicity through sauna detoxification, giving them the nutrients to support glucuronidation, methylation, sulfation, and glutathione conjugation. Methylcobalamin, folinic acid, and glutathione are given many times either by injection or IV. And physical therapy in a chronically ill patient, once they start getting better, is important. And pulsed electromagnetic therapy also helps to reestablish the polarity of sick cells by giving them the earth frequency. And microneurofeedback helps to normalize neurotransmitters in the brain and enhance the repair in the brain. Another important fact is mold and mycotoxin exposure must be considered in differential diagnosis. You first identify the problem, confirm the problem, as in many cases, bacterial or spirochete infection, it coexists. And if we do not treat the mold issues first before giving the antibiotics, then the patient does not respond adequately. So appropriate treatment is essential for the better outcome. So now we are going to talk about PARTS. It is a symptom diagnosis and indicates the dysfunction of autonomic nervous system. It is an indicator of dyshomeostasis. It is indirect indicator, not direct indicator, but we know, once we know the ground regulation system, we know how close is the autonomic nerve fibers to the vascular system and to the neuroendocrine axis. So remember that pesticide exposure and chronic infection can coexist. Patient in point was 100% better on our treatment, which included multi-pronged approach. After she finished her high school, she was attending multiple outdoor parties. Then she started feeling dizzy, and 10 to 20% of the time. She came to us and she had a heart rate variability test which showed recurrence of PARTS and autonomic dysregulation because she was exposed to pesticides and insecticides on the lawn for killing bugs and insects for outdoor parties. She again practiced strict avoidance of pesticide and insecticides and eating organic food. And she received the intravenous glutathione, intravenous nutritional IVs, and she did sauna. She started drinking the water with salt and salt tablet, and gradually, again, she reestablished her wellness. Now she attends a college in Boston. She had a first semester that she had to go to Ireland, where she became sick. Why? She had pesticide exposure because they used that continuously on their campus. Also, the food was poor because she was unable to find her organic food. She was unable to find the food that would make 4-day rotation. So she was unable to eat good diet. She did not have a good water, glass bottle water. So when she returned, she was sick, but we treated her immediately. And within a short period of time, she became normal. And then she went back to Boston to finish her school. And now she's doing excellent. Now they asked her at Harvard to have a PARTS group. And they asked her to write about the PARTS. And so she has become the activist of her not only of her medical condition, but also the approaches of environmental medicine. So now we have to remember that if we have electromagnetic sensitivity, mitigate the home for dirty electricity, electromagnetic radiation, and all of the measures necessary to mitigate EMF from the environment is essential. So do not forget to treat for Candida or Candida-related complex. And most of you know this very well, but indirect marker of Candida infection is also increase in level of uric acid, which gives the symptoms of gout inflammation. But it's not really a gout, but one may mimic like that. But dietary modifications are one of the most important prong of the treatment. And once you do that, the patient starts getting better and the gout inflammation goes away. Gouty inflammation goes away. Ferment-free, no vinegar in any form, not even apple cider vinegar. Eliminate sugar, gluten-free and dairy-free diet. Prepare the gut, reduce the inflammation, and you may use endozyme, which helps to reduce the inflammation. Use probiotics, natural antifungals, use antifungal medication when necessary. And sometimes, in spite of doing all that, sometimes Candida related complex symptoms continues. So then think about Candida related sensitivity. And so you do the allergy testing for Candida and do the LDI treatment if you find the patient is sensitive, and see the response. So current standard of care for the lab testing for the diagnosis and treatment of chronic Lyme and Mycoplasma infection has harmed many patients nationwide. Short-term use of antibiotics are unsuccessful. Patient may develop post-treatment conditions, including myriad of symptoms, neurological tremors, MS, transverse myelitis, peripheral neuropathy, mood and memory symptoms involving limbic system like anxiety, depression, cognitive dysfunction, musculoskeletal symptoms like neck pain, back pain, joint pain, muscle weakness, cardiac symptoms like palpitations, skipping heartbeat, and many patients are misdiagnosed and mistreated and suffered for over 30 years and 30 years of life that they have lost. So you by knowing all these will be looking for this illness in your patients, those who are chronically ill, and provide them the correct treatment. So thus, chronic fatigue is a major symptom of chronic infection and other chronic diseases. All it signifies is there is a mito dysfunction, and HPA axis dysregulation can coexist. IV NAD treatment has helped many chronic fatigue patients. It's not only used for alcohol withdrawal symptoms as first it came to our attention, but it also helps the anxiety and depression deriving from many other sources. If anxiety and depression are associated with the chronic fatigue and chronic infection, you will see the response, not even using very high doses. It revives the brain, restores the brain's function, but anyhow, you have to start low, slow, and it takes time to adapt. Nutritional IVs, IV glutathione are given following the intravenous NAD as it potentiates its effect. This is not the first line treatment, but certainly in recalcitrant cases, you can use this. And when the immune dysfunction persists, when the persistence of organism is a major problem, you can use also the autohemotherapy, the use of photobiomodulation and oxygen ozone treatment, because it helps to oxygenate the tissue, increases the body's natural defense, and enhances the oxygenation and downregulates the inflammation. And one more treatment is a hyperbaric oxygen, which also helps to downregulate inflammation, oxygenate the tissue, improves the microcirculation, and mobilizes the stem cells, the body's own stem cells, that it helps to repair and regenerate tissue, control inflammation, and upregulate the activity of type 2 macrophages. High pressure hyperbaric oxygen at greater than 2.3 ATA is lethal for organism, helps to resolve the infection. However, it is not easily available, very expensive, and insurance companies don't pay for it. In our experience, we have used the low-cost 1.4 ATA hyperbaric treatment for 1 hour. And 30 to 40 treatment helps to downregulate the cytokine storm and promote the oxygenation of the tissue and increase the stem cells and downregulate the inflammation. So there are more modalities exist, and you have to use it's not to be used on everyone, but when one is not better with 1, 2, or 3 prongs, there are multiple prongs, and this is one of the prongs that you can use. In conclusion, comprehensive evaluation and treatment, you can use. The principle is to reduce the total toxic burden and revive the neuroimmune endocrine activation. Reduction in total pollutant load from air, food, and water. Alkalization, hydration, oxygenation by improving microcirculation and oxygen treatment 2 hours a day and hyperbaric oxygen when necessary. Balance the GI microbiome and treat dysbiosis, support the digestion, and do the leaky gut repair. Treatment for inhalant, mold, pollen, food, chemical, mycotoxin, biologicals by LDA, LDI, or PN technique can be done. Replacement of nutrient pool to augment immune function and reduce inflammation is very essential. Nutrient treatment to improve mitochondrial function. Antibiotic therapy for better outcome of Lyme disease, co-infection, mycoplasmosis, and many more infections. In some patients, even you may need to give them the gamma globulin shot IM, which may not be ideal, but some patients with the borderline deficiency have responded well. IVIG can be also given, but it's not very easy to have the insurance company approved for the IVIG, and you have to jump a lot of hoops to get that. But anyhow, there are companies available to help you. Remember, every patient does not need all prongs of the treatment. Start with your basic treatment, which I outlined before into the multi-step diagram. Individual treatment plan is dependent on their symptoms and duration of illness and systems involved. And treatment plan gets modified depending upon treatment response and side effects. So initially, you should draw a treatment plan for the patient and providing the multiple prongs, and then decide how patient responds, and then you go from there. Thank you for your patience, and I hope you learned something.
Thank you, Dr. Patel. That was fabulous. We have a whole slew of questions. I hope you can stick around and answer them. And
yeah, sure.
Okay, so the first question is, how do you use DMPS? If it's IV, and if so, what doses?
DMPS, we use in adult patient about 3 ml, so it is 25 milligram per ml, and we are using 3 ml, so it does not induce the kidney load, and it has we give IV.
Right. Over what time period of time?
We give, when we are doing that, we don't give only DMPS alone. We are doing with the EDTA. So we are just slowly infusing through the side port.
Okay. Okay. Next question. What do you use for Lyme testing?
You know, I practice in New York State.
Mm-hmm.
With very, very, very strict regulation. So I do not have a liberty of using many tests, but I go with the Lyme Western blot, and you know, Lyme Western blot,
Right.
depending upon which company, it's helpful. But then there are some indirect testing that there is a lab, I don't know what is the name of the lab in Minnesota, which is doing the IL-2 response, and Infacto lab, yeah. In Minnesota, which does the IL-2 response and interferon gamma response. So those are the indirect way of measuring. Then there is another lab which is doing the PCR test, but I have not found PCR test to be very helpful. I mean, it's whenever it is a chronic active infection, it can be the presence of the fragments and inflammatory molecules, and it's intracellular, and it does not show. It just shows what is present out in the blood.
Okay. Dr. Heidi reports that she uses IGeneX for Lyme and tick-borne illnesses and Great Plains for mycotoxins.
Yes, I do use the IGeneX lab for the Western blot and co-infection panel. There are many more tests you can order from IGeneX lab in detail, but I cannot use them. At one time, Dr. Boroscano was telling that he is using on the urine, and urine test was very reliable. But I think that was one of the problem when he had a problem with his license, so we are not using that. And then there is a, what was the another question you had? Mycotoxin, urine mycotoxin, I'm
Right.
using the real-time lab because that is approved for New York State. Great Plains we cannot use in New York State. It's a very good lab. It's very good lab, and it gives not only the mycotoxin, but it gives you glyphosate too. And glyphosate is a more pervasive problem. In glyphosate, you can have one large book kind of symptoms and how pervasive it is. So what used to be like aspartame all pervasive, glyphosate is all pervasive like aspartame.
What EMF protectors do you use?
Well, the first EMF protector is do not keep your cell phone near your ear. You have a detector that you can get and find out where is the most highly concentrated EMF activity. So once you find that, then you find out what is the cause. We have found that Wi-Fi is one of the very, very bad. Dirty electricity is another one. So, and then the Bluetooth devices are the other one. So you can, there is a, for cell phone, there is a device that you can use that, and that interrupts the electromagnetic field, and you can use that as a in your it has a little long wire, and you can connect to the side port and you can listen. Otherwise, you put your speaker on at night, you turn everything off. And if you have a Wi-Fi, you turn off your Wi-Fi. But Ethernet connection is optimal.
Do you use microbiome labs for or megasporidics products?
I use Megaspore products, yes. Microbiome, Megaspore products I do use. But one product for leaky gut I have found the most helpful is from the orthomolecular, and that is the SBI Protect. It is expensive, but I think it is worth when your patient is very sick, you use that, and within 3 months the patient is back to almost normal.
What was that again? Could you repeat it?
S as a Sam, B as a boy, I as a ink, SBI Protect.
Okay, got it.
From orthomolecular
Right.
How
products.
about brands and types of water do you recommend?
We have tested a lot of different waters when Bill Ray and we had one small lab just for doing the internal work. And we found that the Mountain Valley had the least amount of problem, contaminants, as compared to all other water. The next one was Evian, but depends upon, like, if you buy Evian in Chicago at the time, it was most contaminated. So I think somebody was doing some dirty tricks down there, because but I think glass, it is very important it is in glass, because people would say, oh, well, what is problem? What is wrong with Poland Spring? Well, it comes in a plastic container, even 5-gallon jug, and all throwaway bottled water is waste of money and contamination of body.
Can you give IV NAD with vitamins separately or together?
You can give a small amount,
Mhm.
like with your other ingredients.
Okay. Can IV antibiotics affect the microbiome or just oral antibiotics?
No, IV antibiotic can affect the intestinal microbiome, but not as bad as the oral.
Okay, Dr. Crowley says, another great talk, Dr. Patel, thank you. Can infrared mats help?
Infrared mats, I would not lie down on that.
Mhm. Okay. Do you use Candida antibodies?
Yes, I do, but New York State, again, so occasionally some lab would provide, otherwise say it's not allowed in New York State. But whenever I have showed it to some patient, it is always good to do the test sometime, to show it to the patient that, look, this is a real problem. Look at your antibody levels. Look, that means that is attacking your body, and your body in response is making these organisms.
How long did you use the antibiotics in this case?
The case I had
Right.
about 6 months.
Okay. I think you might have answered this. What is the dose for IV NAD?
See, IV NAD, you cannot use from any manufacturer, okay? Usually it is coming from the compounding pharmacy, but every compounding pharmacy does not make it the same way with the same effectiveness. So you will get here and there the announcement that IV NAD is available and it is at a cheaper price, but you have to be very careful. There is a Springfield pharmacy that makes it too, and sometimes it is 50 milligram per ml, and some pharmacies have 100 milligram per ml. If you try 2 or 3 ml, you will be okay. But as soon as you cross 3 ml, your patient can have more side effects of it, because it has to be given very, very slowly.
Mhm. Okay, do you get a similar effect from ozone or peroxide IV compared to hyperbaric oxygen?
So NAD effect is completely different. You will find a different type of patients giving you different things, but usually I don't put the NAD as a first intervention. I would give them the oxygen ozone treatment with the photobiomodulation. The light comes and it goes through that light. So I give them that, and then after that, I give them the nutritional IV, glutathione IV, and then I put them in hyperbaric oxygen.
What about plastic water bottles or bottles that say that they are BPA free? Are they safe?
Right. But the thing is that I'm just not happy, because they break easily. There is whatever they are using when before BPA it was phthalate, remember? And then when phthalate came under pressure, then they developed BPA. Then when BPA came under pressure, they developed something else. But these all plastics, they are leaching, and then they accumulate in the liver, and then they have a problem of the liver enzyme upregulating the liver enzymes, and then the all detoxification disorder develops, and we don't know what gets upregulated, what gets compartmentalized, what gets the endoplasmic, what happens to the endoplasmic reticulum. And we know that liver is a place where the cadmium gets deposited, okay, sequestered, because all these metals and chemicals are sequestered in different organs. Like mercury goes to the brain, and then polycyclic hydrocarbons go into the cell matrix, and then in the cell membranes, the all the solvents like toluene and the TCE, the trichloroethane, which is the fluid that they use for dry cleaning fluid. So that goes into the cell membrane. So these all different chemicals are sequestered differently. And then when person becomes sick, we don't know, some have a problem with their glutamate channel, some have a problem with their chloride channel, some have a problem with their calcium channels. So we have to really think that you think that these companies are going to tell us that what they have in those bottles. So I'm completely against that. It is not a natural substance. It is a synthetic. It does leach because the water is acidic. And even if it is alkaline, I don't care. I think that the food should be stored in glass, and the water should be drank from the water bottle, glass bottles.
All right, this is from me though. What about, have you used low dose naltrexone as an anti-inflammatory?
Yes. This patient was on it, but I have found that they are more intolerant. So as they get better, they become more tolerant. So, and sometimes some patients, not this patient, but some patients come with a severe degree of fibromyalgia along with the chronic fatigue. And when they have a fibromyalgia, then they are on a lot of medicine. Either it is oxycodone or oxycontin or this or that. So then I have not used with that, but then Dr. Irma Ray, she said that you can use it and then gradually take them off their pain medication. So I don't know, what is your experience?
Well, we use what's known as ultra low dose naltrexone. So we use 1 to 2 micrograms, not milligrams, and then slowly reduce the opioids or the narcotics about 10% per every 2 to 4 weeks. And
so how do you tell your pharmacist to prepare 1 to 2 microgram?
I have 2 pharmacists that I just write it 2 micrograms naltrexone, 2 micrograms, used once daily, and we've not had a problem with it. You know, they tell me that they're making it. I mean, I have to follow. You know, I have to trust that they're doing it the proper way. But
so we've had about 5 patients that we've done treated with it this way, and we've had good success with 4 of them. So one sort of had a relapse, but that's what we've been using. So for those that are on opioids, the ultra low dose naltrexone.
Somebody mentioned here, let's all be Amish.
Yeah,
Let me tell you
Dr.
about,
That's Dr. Halassa, you know, he's back from Turkey, so he's
okay, because
he'll be
I have enough Amish patients, those are super sick when they
Yeah.
come, because you have to understand that they use their heat is their big pollutants,
Mhm.
and
Well, I think,
and everything they use is not organic.
yeah, I
They-
think he was more referring to, you know, you gave us a whole list of things that we're going to be living in caves otherwise, you know, no air conditioners, no water bottles, no, you know, no, well, the whole list.
yeah, but sicker they are, they need that.
Yeah.
And I think I would try to live life like that, so I don't end up having the chronic degenerative disease.
I think he's teasing you. I don't think he's being serious about it. So, all right, I think he's kidding you there. So, anybody else have any other questions, comments? Fabulous as always, and you know, you're always one of our favorite speakers. And please, you know, please be available for us, you know, anytime. You know, we always need you.
Okay, very good. Thank you.
Okay. Okay. Anybody else have? So next week we have Dr. Halassa is going to pontificate on you know, all that he's been up to since we last heard from him. So we kind of lost him over the summer. So
That's wonderful.
but I'm glad he's back.
Well, I'm surprised he didn't speak a word.
I know. That's so unusual for.
Yeah.
Okay. One question: does ultra low dose naltrexone help with chronic pain? Not in my experience, not really. We've kind of been using it exclusively for opioid, you know, as to reduce opioid addictions. That's what we've been using it for. So,
Well, Dr. Patel, you're too smart for me to ask any questions. That's the reason.
so okay, you had to get something out of him there.
Right.
You know, it must have been killed.
Well, she did a great job. She did a
Of
very
course.
good job when we have together the presentation
Okay.
on Monday, which we're going to present it again. So I needed to be there to help me out there next week.
Okay,
Make sure you're
so-
there.
Okay, well,
Okay.
Dr. Patel,
all right.
make sure you're there to help me up.
I'll do what I can. So, so this weekend is OMED, which is the AOA Scientific Convention. If you need CME credits, there's 30 total AOA credits, 50 total AMA credits. If you do sign up, go to OMED 21 and then just type that in a search engine and it'll take you to the registration page. If you sign up, please sign up under us, American Osteopathic Society of Rheumatic Diseases, or AOSRD. We get credit for it. It's Friday, Saturday, and Sunday. They tried to throw us out, but we didn't let them. So we are presenting. All the lectures are pre-recorded. Dr. Spear is doing Friday mornings lectures, and it's you know, everything you need to know about rheumatology. Friday afternoon, I'm doing introduction to bioidentical hormones and what you need to know about male and female hormones. On Saturday is Cannabis Day. Dr. Crowley, Dr. Sulak are our main speakers. Sunday, also we have Dr. Sylvia Cruz, which is Mrs. Dr. John Burgess, and she talks about physician burnout and something about the electronic medical records. We also have Larry Oxenham, who is our resident financial planner, something that we don't get a whole lot of experience with. And on Sunday, we have Dr. John Hughes, who's going to be talking about traumatic brain injury and hyperbaric oxygen. I'm going to be doing, I think I'm going to be doing my hair lecture. I think they have that one. And I'm doing the thyroid show. And also, I think that's about it. So that's this weekend. That's Friday, Saturday, and Sunday. It starts 9:30 a.m. It's Central Time. All the times are Central Time. If you get the schedule. If you want our schedule, send me a quick note and I'll send you our schedule. There's 15 subspecialties presenting, and then there's also family practice, internal medicine. They have their keynote speakers are speaking also. But like I said, if you do sign up and for credits, please sign up under us because we get credit for it. Next weekend, next Tuesday, Dr. Alasa will be telling us about all of his updates. He's been traveling the world, and we're anxious to hear that. And lastly, we will be going to Las Vegas on March 25th to 27th, 2022 for a live show, and hopefully it won't get canceled. And it will also be online. And anybody who wants to present, please let me know. We'll be putting the program together in the next couple of weeks. We're going to be at the Flamingo Hotel in Las Vegas. And it's the first time I've been involved with one outside of Reno. The problem with that is that I don't really know the after hours crowd like I did here. So, but we'll be able to attract a bigger crowd. It's one flight from the East Coast instead of two, and it's on the Strip. We have a really good room rate. It's going to be not even $250 for 4 nights over a weekend, which is like almost unheard of at the Flamingo Hotel. So I'll be sending out some information on that. If you have something you want to present, please get in touch with me. And I think that's about it for now. Dr. Patel, great job as always. Please come back, and we'll be anxious to hear from you again. Next week, Dr. Halasa. Anybody else? Dr. Burgess, you have anything to say about this weekend coming up? If you're still there.
I'm here and I have nothing to say. You covered absolutely everything.
Okay, great. Okay, and so we had some new people come again tonight, and thank you so much for coming. Please bring a friend so we can expand our reach. And if anybody wants to present, every Tuesday night we're here. So there's hopefully dozens and dozens of Tuesdays coming up, and so we have plenty of time to present. As you know, we're all pretty laid back and friendly, and we all try to help each other. So if you're new at presenting, this is a great forum for it.
I have a couple of speakers. They're very good. I will bring them up.
Okay, please do.
Yes. Okay. See you next week.
Okay, so everybody, thank you so
you.
much.
Good night.
Bye-bye.
Good night.